Hi beauties, welcome to my channel h.i.beauty.by.yulia. I'm Yulia and I'm your virtual beauty therapist. If you're new here, welcome. I have been a beauty therapist for the past 10 years, so I do hope you enjoy my tips and advices about your skincare. The idea about this channel is to keep you healthy and informed about beauty. So without any further ado, let's talk about sensitivity. Sensitivity is something that a lot of people do say they have, but is your skin sensitive or is it sensitized? What is the difference? Are you doing something wrong? Is there some kind of medical condition underlying the problem with your skin? Let's see about this. In a recent study that was looking into women's skincare here in Britain, they found that around 33% of the women are saying they have sensitive skin. But what is more concerning is that in the age gaps between 16 and 34 years old, this percentage goes up to 40%. The theory why women's skin is more sensitive than men's has a lot of different ideas behind. The first one, and probably the most for me that makes sense, is the fact that their skin is indeed thicker. So it is in general more resilient. But also the other issue is that men tend to not use so many products as we do. They don't change them so often. So if you look at your skincare routine, you'll be using something in the morning, another in the evening, in between some masks and pills maybe. While if you look at your partner's brother, father skincare routine, if they do have any, it will be 2-3 products, just some basic ingredients, and that's about it. So although we think it's a great thing to try a lot of things and test them in order to improve our skin, we also expose our skin to much more than men do. So with regards to sensitivity, genetics do play a huge role. There might be some kind of medical condition, whether we are looking on the skin or some kind of internal issue. But more often we do something to our skin and we disrupt our skin barrier. This is something that we do need. It keeps us safe, keeps the water inside, the irritants outside. So if our skin barrier is intact, it's all great. But if we do something, we overclean, we use too many actives, we overexfoliate, we swap products too often, then the likelihood of you doing something wrong is much higher. And maybe that's why you have sensitive skin. So let's talk about this. If you're trying to determine what is skin sensitivity, you will be very confused because the truth is that there is no description that everyone is saying, yes, that's right. So it is very confusing. In general, this type of entity, sensitivity, was found in the end of the 80s and it was called cosmetic intolerance syndrome. However, later on the scientists found that it's not just towards cosmetic that we feel sensitive, so they changed it to sensitive skin syndrome. But that's also not something that everyone is accepting. Now all this sounds quite sciencey, but in general, what this means that this is just an angry skin. You can see itching, redness, tingling, burning sensation, and it's not just from one product, it's from most of the products, and you can see a lot of factors such as diet, even clothing, temperature, the wind, everything is affecting this type of sensitive skin. What is important to understand is that this kind of sensitivity and unpleasant episodes could happen straight after the application of something, happen after an hour or two, or actually happen after a few applications. So we are looking for some kind of accumulating reaction towards certain product or certain ingredients. I think it's important to understand that there is different kinds of sensitivities as well as different causes and intensities. Sensitivity always comes first. And while this is a safe way to treat your skin, that also means that it will be very gentle. So the results that you will have for any other concerns you might have will take longer to happen. I like to make a difference between sensitive and sensitized skin because, as I said, very often we do something that makes our skin very intolerant towards everything. And if your skin is, say, having some reaction, had some reaction for the past 30 years once or twice from a product that maybe you have done something wrong and your skin was sensitized, but typically it is not reactive, it is not getting irritated from a lot of different ingredients. So we say that the skin is usually resilient or normal, although I don't really like this type of terminology as a normal skin, but that's a whole nother story. My point is that your skin is not sensitive usually, but obviously if you do make it very angry for some kind of reason, then yes, it will be more reactive. While sensitive skin is skin that is just not happy skin. Sensitive skin for me personally is something that very often will be genetically predetermined. So for instance, my mother has a very sensitive skin. I mean, she has been using a particular soap that is the only thing that she could use for her body, and I'm not even starting with the face. So her skin is reactive towards everything from perfumes to cosmetics to body care to detergents, everything. And when you have a parent or someone else in the family who has this type of sensitivity or some kind of medical condition such as eczema or psoriasis, very likely it will be part of your genetic code. So you might get something like this later on in your life. This is obviously not 100%, but it means that maybe your skin is predisposed to be sensitive. Also, obviously, the difference comes from the fact that sensitized skin happens very occasionally, while sensitive skin is something that happens most of the time. So for me personally, if I have to say it shortly, sensitized skin is self-induced reactive skin, while sensitive skin is skin with often some kind of underlying issue, skin which is most of the time very sensitive, and it has some kind of genetic reason behind it. I hope now this makes sense for you and you understand why I am making this type of difference. However, if your skin is sensitive or sensitized when it is in its bad mood and we're looking into reaction, it happens in general really because some kind of irritants was around you, so your skin, your immune system goes a full blown immune response and it triggers reaction, whether it's flaky, dry skin, redness, itchiness, rashes, or anything else. As I have already mentioned, usually the problem with sensitive skin is towards the barrier that is no longer intact. There's a few causes that we consider about general medical conditions or reason why you might have sensitive skin. The first medical condition that I want to mention is eczema or atopic dermatitis. Here the problem is that your skin barrier no longer can protect yourself from any kind of irritants. So everything that is not supposed to be irritating and it's not for anyone else will be for you. And this is not just your skincare or your makeup. We are talking about any kind of bacteria in the air or laundry detergent or even the alcohol in your hairspray. Everything is going to affect your skin, make it red, flushing, irritated. So how to fix it? You do have to speak with your healthcare provider. You need to have a proper consultation. Sometimes over-the-counter anti-itching medication is going to help because it will feel itchy on your skin, and it's very important to moisturize because you need to repair the lipid barrier. So using occlusive products and as less as possible ingredient into your products is going to help you. The second very common condition is irritant contact dermatitis. So what happens is that once you apply, say, your product on the skin, almost straight away you can see reaction from your skin. So it feels burning, it feels itchy, it feels red. If this happens, very likely that's the problem. Now, it heals by itself if left alone, but as someone who suffered a few times from this, it's super itchy. It's very difficult to just let it heal. So what you can do is you can get some kind of steroids or numbing cream, or one of the best ways to suit your skin is to have some kind of oat baths. The other less common variation of contact dermatitis is when it is allergic contact dermatitis. Now, this is a reaction, it is an immune response which is building up. So you will not get reaction the first time that you, say, apply your product, but each time that you are applying, your skin will get angrier and angrier, and in one point it will just explode. And this is something that very often will be a perfume. This is the number one reason for allergic contact dermatitis, and that's why I'm saying you should try to avoid it as much as it's possible, because it is everywhere, from your home care, your skin care, your body care. It's just everywhere, and it's very difficult if you already have some kind of allergy to avoid it. So the other reason why you can see something like this is preservatives. Certain types of preservatives are considered to trigger also this type of build-up allergy. And if you think you are safe with your clean and natural products, you're not, because they very often contain essential oils, and they're the other very, very common reason for allergic contact dermatitis. What you can do is you can get antihistamine, over-the-counter lotions, and you have to make sure you find what is triggering this allergic reaction, because it is a specific substance. The best way, go and see a dermatologist and don't try to self-diagnose yourself. And the last medical condition or disease that we are looking into that causes sensitivity is rosacea. And this is a very, very common. It means that your skin is red and flushing much more than to the rest of the people. Your skin is much more sensitive, and if you don't treat it, this redness will become more and more permanent. You will see some blood vessels very likely over the face, and it can get so bad that you can have rosacea acne even. So you do have to speak with dermatologist or any healthcare provider and discuss. It's a condition that doesn't heal completely, but you can get under control with medication, with your skincare routine, with professional treatments as well. One of the most common reasons why anyone without medical condition can have sensitive skin is dry skin. And the reason is because your skin doesn't have enough water. Very often your skin barrier is already damaged and not so efficient, so it's much more likely something to cause irritation of the skin. That obviously does not mean that if your skin is oily it cannot be sensitive, but it means that the likelihood of having sensitive skin when your skin is dry is higher. So what you have to do is, once again, repair the skin barrier. Make sure that you're using moisturizers and ointments. Once your skin is in better condition, make sure that you keep this moisture into the skin. And I have to say also that when we are looking for a test, there is no test per se for sensitive or not sensitive skin that a healthcare provider will give you. They will do, however, if they worry about some kind of allergy, a back panel, so they will apply some allergens that are well known. Once again, if you're allergic to something that is not so well known, or your dermatologist doesn't have this type of sample, that means that you will not know for 100% if you're allergic towards this substance or not. Thank you very much for watching this video. I hope I gave you enough information to determine whether your skin is sensitive or sensitized, what are one and the other. I was Yulia. Please consider subscribing to my channel. If you enjoyed this video, give it a thumbs up. Check out some of the rest of my videos, and I will see you next week.